Okay, India won against Sri Lanka yesterday with a very good margin. And what every cricketer wants that he should hit hard and he should stay long. And this has been every man's view in his bedroom, that he should be performing well and sustain for a good time. And we have seen beautiful presentations from Dr. Ashokan and then Dr. Rupin and the other speakers now. All have described very well about the sexual dysfunctions. One thing I want to tell you all is that if we at all have to treat these sexual dysfunctions which occur, we should start treating as early as the age of 30, because most of the metabolic syndrome or most of the diseases which occur are all at this age. And if any patient has a family history of metabolic syndrome like diabetes, hypertension, obesity, dyslipidemia, this is the time where we can alter his endothelium and restore the endothelium, which is the root cause of every sexual dysfunctions. So with this little brief, I would give you some nuggets of wisdom in this next 30-35 minutes as to how we can address these issues and how we can see that every man or a woman can have a good quality of sex life till she is alive or he is alive. With pranams to God and thanks to my teachers Dr. O.P. Kapoor, Prakash Kothari and Sashank Joshi, I always beseech them to bless me always. Mitron, I have offered you GST. Look at his hands are down. Then he told me, Deepak, you also offer your GST. So look, my hands are up and I shall offer my GST, and my GST to all of you is great sex therapy. And I have a disclosure. I am not from Congress, BJP, Shiv Sena or Aam Aadmi Party. I am not a follower of Asharam Bapu, Ramdev Baba or Radhe Ma. I am not married to Indrani Mukherjee. I am a pure Indian Medical Association-ite, and I am passionate to preach the art and science of sexual fitness and how to treat sexual dysfunctions ethically. I am not, this is what Rekha told to Amitabh now when the Article 497 was released or enacted. She says now Article 497 is off. But then what Amitabh told her, that now it's too late, I am become old. But then after some thoughts, he said, let me talk to Dr. Jumani. What men think they want and what women think they want in their sex life in their bedroom. Let's unravel the blindfold. At 15 to 20 years, everyone has hormones which are bubbling. It's called tempting 20, pehla nasha. At 20 to 30, this hormones are at the peak, dhoom macha de. Between 30 and 39, they have good times and they have bad times. There are breakups. So it's kabhi khushi, kabhi gum. At 40, he's fearing, Salah, kal erection ho na ho. What can I do for it? So he becomes naughty. So he tries to do something what he could do because he fears that after this age, he may not be able to do anything. But at 50, what he realizes is that Papu can't dance, Salah. He's already got ED. But at 60, he says, Buddha hoga tera baap. And he still has those hormones bubbling. And even he says that sex at 60 is possible. Why not? So, no matter how much a man loves his wife, his attraction to the opposite sex never ends. Some married men will act on these impulses of attractions while others will try to hide it. Men over 40 will try to do everything they didn't get the chance to do during their younger years. And it is beautifully said that the grass is always greener on the other side. At the beginning of marriage, we all know every wife treats her husband as God, Pati Parmeshwar. But I don't know, somehow after the marriage, what happens? The words interchange. The dog, God becomes dog. And men after 40, what urges make men chase women they have no intentions of marrying? It's the same urge that dogs make chase vehicles they have no intentions of driving. So after the age of 40, if you are chasing someone, please think what you could be. We are living in an era of stress, innovation, internet, competition, sex saturated society, novel therapy, and of course, Dr. Google patient or Google Masi patients. So, we need to be more aware, we need to be updated, we have to set high standards. Sexual dysfunctions are very, very common, underrated, undertreated also. And also, we should know that first we should do no harm. This is the oath we have taken. What have been studied is the survey done shows that 40% of men above the 40 are having dissatisfied sex life. Erectile dysfunction affects 50% of male population over the age of 40. When I googled, I found Viagra had 196 million web pages and aspirin had only 53 million web pages. Another survey done said 62% of women admitted that they were not satisfied with their sex life, either due to their partners having erectile dysfunction or due to their own sexual dysfunctions itself. The most developed country like Japan, 50% of married couples in Japan don't have sex. They are living sexless lives. And what we see today in our country, that most of 1 out of 5 divorces are due to impotence. These are the data of the family courts of India. Now, let me give you a newer perspective of all this. Henry Maslow, he was a famous neuropsychiatrist. He said that there are hierarchy of needs. First, we need to know self-actualization, which is due to morality, creativity, spontaneity, and problem solving. Then we should have good esteem, confidence, achievements, whatever. We also need to have good friends, good family, and sexual intimacy. And also, we should be learn to be secured with body, employment, resources, the family, health, property, etc. But in the end, if you see, the food and sex have formed the most important aspect of the hierarchy of needs, which is very important. When we look at this lady, she is the most beautiful woman in the history of mankind. She was naturally beautiful and healthy, and she was the epitome of passion, love, beauty, and femininity. She was the height of confidence and attraction. She could make any man attract and fall for her at first sight. She was known as the goddess of love, beauty, and sexuality. She was none other than the Greek goddess of love, beauty, and sexuality, known as Aphrodite, on whose name aphrodisiacs have come. What was Aphrodite doing that made everyone lust for her? What made her attractive? What made her feel so sexual and sensual? The whole secret is that it lay in the diet of metabolic superfoods which she had. And this unusual ancient diet that sexiest and healthiest people consume is still available to all of us. 2 times Nobel Prize winner Dr. Linus Pauling declared when he was accepting his Nobel Prize that nearly all disease can be traced to a nutritional deficiency. And when we look at Kama Sutra and the perfume garden and most of the literature, both mentioned various foods which are there which enhance sexuality. And we have seen that this was not a taboo at all in the ancient years. I took this picture from the temples of Bhuvaneshwar, and I'm seeing the Shiva with erect penis. So this is the whole life was vibrant, and people were not ashamed to talk about all these things, because sex is God made, restrictions are man made, love is a matter of chemistry, and sex is a matter of physics. And intimacy, or the science of intimacy after 60, is both chemistry and physics. So sexual fitness, friends, is a lifestyle decision. We all should learn to be sexually fit. The art and science of sexual fitness should be learned and taught to everybody, because we know aging is inevitable, intimacy is ageless. But to ignite intimacy, we should have strategies of mind and body together for getting optimum sexual pleasure. But can intimacy once lost be reignited or restored? Yes, it can be, because we are seeing a lot of longevity hotspots across the world. There are 5 hotspots in the world where people are staying more than 130 years and are sexually active. So these are called blue zones. Mr. Dan Buettner, who was a scientist attached to Natural Geographic, he lived at these blue zones and found out what happened to them and why did they live for more than 100 and 120 years and are physically and sexually active. But question which I ask today to all of you is, can we make India as a longevity hotspot? Yes, we can, because there is a bridge. We have to bridge the gap between the lifespan and health span. We are all going to live long. The 60 plus gifted years, do we want to live in autonomy, dignity, grace, and sexually happy, or do we want to live diseased, depressed, dependent, unhappy, or emotional? This is the choice we have, because there is no age for sex. According to me, a man or a woman can have sex from 9 years to 90 years, and it can be had anytime in the morning, afternoon, night. And friends, trust me, sex really has no expiry date. We are born because we had a life, and we will die. We do not have any options between birth and death. Okay. But whatever happens to us between birth and death, to me, to you, or to anybody, is the C in between, the choices we make. And whatever happens to us is all because of the choices we made. And we have wisdom. So we must learn to make right choices. Now, let me give you a little deeper perspective of what I said. Every male today has some bedroom woes, more in younger men today, because they have freedom, they have money, they have internet, they are exposed to internet, they smoke, they take alcohol, they take all sort of substance abuse, they involve in lot of pornographic watching, etc. So the onus of sexual health of our patients lies with the physicians. We need to ask our patients. Patients will not come and tell us. We need to break the ice. We need to talk to them. We need to ask them as early as the age of 30 that do you have problems in making love? Friends, trust me, if you ask this simple question, it will open up a Pandora's box and you'll be surprised that your patients were waiting for you to initiate a dialogue on this aspect. A global study done that in India, only 4% of doctors were asking these patients. So we need to learn to break all the barriers of clinical inertia and ask our patients about this. This is the first take home message which I have. Now, what has been science telling us? Is sexual activity beneficial? Does it help our cardiovascular system, or is it a risk factor to that? Now, sex, according to the American Heart Association and American Urologic Association, it is the best prescription of good health because it improves every system of our body. And it is said, use it or lose it. Sexual activity has been a predictor of general health. It's inversely related to mortality. In a cohort study, mortality risk was 50% lower in men having higher frequency for orgasm, and men reported intercourse less than once per week had 50% or twice the chance of erectile dysfunction compared to those reporting intercourse once a week. Duke's longitudinal study says the frequency of intercourse was a significant predictor of longevity of men. I will come to this point very soon. How important is this to understand? Early cessation of sex was associated with premature death, and 50% of reduction in cardiac death, which is one of the most common cause of global mortality and morbidity, which was seen in if patients had 2 orgasms per week. So nobody has died of having sex or while doing intercourse. So sexual activity triggering myocardial infarction is less to be worried about. JAMA clearly tells about it. Heartbeats stay at normal rate when one beds with a legal mate, but roosting in another's nest flirts with cardiac arrest. So the majority of post-coital deaths which have occurred were while having sex with unfamiliar partner in an unfamiliar setting after having excessive alcohol or food intake. A beautiful study of 8,000 participants above the age of 50 said 65% were sexually active, and out of that 45% said that they had sex once a week. 70% said sex was more fulfilling than when they were having while they were young, and 76% said sex doesn't get boring as we age. Another study about the age of 60 to 64 years, active sex life according to them was an important sense of well-being. Sex was pleasurable. It was seen in 81% of men and 56% of women. A 30-year-old study with 1,506 participants, all aged 70 and above, they said that there was they had more sexual satisfaction, less sexual dysfunctions, and they had more positive attitudes to sexuality. We had lot of barriers. Doctor before me told us very well what were the barriers, and we also, doctors have a barrier. My friends doctors say that I see 120 patients in a day. I tell them, sir, you don't see 120 patients a day. 120 patients see you. So they hardly look at the reports. All diabetologists, so many doctors I see who send me patients, they just look at the report. They don't even look at the patients, and they prescribe, and that's all it is. So what we need to understand is, as we physician, we need to ask 4 questions to a male or a female after the age of 30. That do they have desire to have sex? Now, if there is a discrepancy in desire, it is definitely due to hormones. Does a man get erection or a woman gets lubrication? Yes, we have a lot of causes for that. Is he able to penetrate and sustain for a good time? This is again another issue which was very beautifully described. And orgasm, and then one on this, later on you should ask about the satisfaction. So these are the 4 cardinal events which occur, and this could be less or more in every patient whom we ask the history about, and that's how we can come to it. Sexual dysfunctions, beautifully described by a previous speaker, erectile dysfunction, premature. I will not go into the details about it, but we must understand that there are normal age related changes in men and women. They have less of testosterone, males have fewer and less functional sperm, reduced penile blood flow, reduced penile smooth muscle relaxation. And in female, we see cessation of estrogen, reduction in testosterone, cessation of ovulation, reduced pelvic blood supply, shortening and narrowing of atrophy of vagina, vaginal elasticity and muscle tone all reduce. And we all know about the DSM-5 criteria about female sexual dysfunction. The hypoactive desire disorder and arousal disorders have now merged into female sexual interest or arousal disorders. Orgasmic disorders remain unchanged, and dyspareunia is definitely now converted into genitopelvic pain penetration disorder, in which we have vaginismus and dyspareunia. What do women want? Let us understand, they have a high degree of focus on emotional and relational aspects, and they don't want medication. They want a lot of other behavioral therapy. Of course, pharmacological treatment does help and is available, but more is the relationship. So why sex is different? Why do we say that sex should see? Sex is not a secret to anybody. Every school going boy or a college going boy or a girl knows what is sex. So sex is not secret. What we should understand is sex is sacred. That is very important to realize and to believe in that. So sex at 60 or above is very, very useful. Why? Because you don't have to worry about the future, about the career, about pregnancy, about menstruation, about you being disturbed, you have to go to work or anything. So you have a lot of freedom and a lot of time to give to each other, a quality time which is needed, and you can prioritize this. You can increase your romance in this time, you can increase your connect with your partner very much. So this sex becomes very different. You can hold each other. It may not be vaginal sex all the time, but just holding each other, walking together, traveling together, going for movies, plays, and discussing so many things together in alone in conjugal environment is very, very important, and that is very important at this stage. So there is a myth that elderlies are not interested in sex and could not perform if they are. Why? Because the studies show that 79% of men above the 70 years and 69% of them either masturbated or had good sexual contact. 86% men above 70 and to 90 expressed interest in sex. Two-thirds of married respondents said a sexual relationship made life meaningful. And 72% of all above 75-year-olds said that men and women felt very sexy when they thought about it or when they did it about. So let's see. I will not go into the detail about the sexual dysfunctions, but I will just touch upon it because Rupin has touched very beautifully about. So what is erectile dysfunction? Prevalence is more in diabetic patients, in hypertensive and dyslipidemia, and we know that India is the diabetes capital of the world, competing with China and losing to China. So I call erectile dysfunction, though it is one of the most commonest complication of diabetes in India. Chindia are the diabetes capital of the world, because one of the complication of diabetes is erectile dysfunction. I call Chindia are the erectile dysfunction capital of the world. In men who have ED, it's nothing but emotional dysfunction. Anxiety has been one of the most common things which we see in them. It's highly prevalent, lot of causes to it. Mostly they are psychogenic, vasculogenic, neurogenic, hormonogenic, iatrogenic, and now even genetic causes. 70% of all men who have ED have associated cardiovascular disease. This is what is very commonly seen. And the current status of cardiovascular disease, that it is at the turn of century, cardiovascular diseases are the leading cause of mortality in India. And in Indians, it develops, coronary artery disease develops 10 years earlier than all others in the age. So how do we increase the intimacy between all them? 50% of mortality is due to non-communicable disease, and that is also due to cardiovascular disease, which we are seeing. Erectile dysfunction, friends, is an endothelial dysfunction. This is what you need to take home from this. So what we need to cure is, PD5 inhibitors come much later, as Rupin beautifully said. What we need to see is how do we restore the endothelium. That is curative. That is what we need to work on. And the strategies to restore endothelium is available today. If you try to restore endothelium, if you try to correct the arterial atherosclerosis, definitely you are going to cure your erectile dysfunctions. And this was my PhD study. Erectile dysfunction is the earliest marker of myocardial ischemia. Montessori beautifully explained with the artery size hypothesis. Penile artery has the lowest diameter, 1 to 2 millimeter. Coronary artery has little higher diameter, 3 to 4. Internal carotid are still larger, 5 to 7 millimeters, and femoral artery 6 to 8 millimeters. When atherosclerosis develops, 50% of the penile artery, if it gets blocked, the cutoff of this is 50%, it will develop a symptom of erectile dysfunction. But the same amount of atherosclerosis, because atherosclerosis is generalized in the whole vascular bed, does not occlude 50% of coronary artery or internal carotid or femoral artery. So, if the symptom of erectile dysfunction develops today, the symptom of coronary artery occlusion, which includes stable, unstable angina, acute myocardial infarction, will develop after 3 to 5 years. So, you have 3 to 5 years of window period of curability where you can change the lifestyle of your patient, correct the metabolic disorders, ask him to quit smoking alcohol, and guide him what is the nutritional importance, counsel him very well, and you can retard the onset of critical events like stable, unstable angina or stroke or claudication, etc. So that is why erectile dysfunction, the symptom of erectile dysfunction in the history taking has to be very, very important as early as 30 years of age. When we look at the progression of cardiovascular disease, which begins from the endothelial dysfunction to clinical events, we see all these patients having erectile dysfunction already. It is no point in you taking a history of erectile dysfunction once he's developed angina or angioplasty is done or a bypass is done. You have missed the boat. You should have asked him at least 5 to 10 years before. That is what is important. So, erectile dysfunction is the first sign of cardiovascular disease, and there is a period of 2.5 years of development of coronary events or stroke, etc., in patients who develop ED. And that is why the new horizons which we learn today of improving endothelial functions, because the risk factors of cardiovascular disease and erectile dysfunction are all same. In fact, ED can be a prognostic marker or of prognostic value in cardiovascular diseases. So, having ED is nothing but having subclinical cardiovascular disease. Please remember this, friends. How do we manage ED? Beautifully covered. Rule out psychogenic. You can rule out psychogenic ED by one simple question. Ask him that in last 8 days or 15 days, did he have morning erection? If he says yes, he had morning erections, which was much hard enough than what he got when he was with his friend or wife or anybody, he has got psychogenic or situational erectile dysfunction. He does not need PD5 inhibitors. All he needs is counseling. And we have very beautiful questionnaires, IIEF and SHIM5. Beautiful. You can diagnose whether he's got erectile difficulties or orgasmic difficulties or penetrative difficulties, etc. A lot of strategies to manage. I will not go into the details. But one thing I want you all to tell is that please look at the retina of your patients who are diabetics, look at the feet of their patients, and look at the oral hygiene. You can give him office sildenafil test or do an intracavernous vasoactive drug injection test, which have already been told. Or these are the additional tests which we do. A salivary tumor necrosis factor alpha can easily detect erectile dysfunction severity. Very simple. Take a swab and put it in the gums and give it for checking. You get the answer. A CBC, simple CBC, and platelet lymphocyte ratio. If you do platelet lymphocyte ratio, if it is more than 105, it's got mild erectile dysfunction. If it has got 116, it's got moderate. If it is 136, it's severe. So, very simple CBC, which doesn't cost much, which we do in every patient, can tell you the diagnosis of severity of erectile dysfunctions. If you are embarrassed to talk to your patient, just look at his CBC, and they do a mental calculations of platelet lymphocyte ratio and then confront with him. He will call you a Sai Baba. Oh, doctor, how did you know? I didn't tell you about it. That's the secret. Please learn about all these things. And we have a beautiful age reader in diabetic patients. That is, just put a hand on this gadget. Through skin autofluorescence, you can diagnose advanced glycated end products and the severity of erectile dysfunction in diabetic patients. How do we treat? There are three ways to treat: diet, exercise, and medications. That's the only thing. And medical food is the need of the hour, which you can understand. The term nutraceutical, Stephen Defies beautifully described as nutrition and pharmaceutically cut the two into half and made it nutraceuticals. And what these nutraceuticals do, which I will tell you later, they produce nitric oxide. Now, what is the science behind nitric oxide? Nitric oxide expands the blood vessels by average of 26% in most of the vital organs like brain, kidneys, penis, and the heart. So we all know that we need more blood supply because blood supply is reduced in patients with hypertension, vasoconstriction, loss of elasticity in diabetic patients. In dyslipidemia, again the volume of the blood vessels reduce. And nitric oxide, we know it reduces as we age, like testosterone. So these patients who are at the age of 60 have only 15% of nitric oxide left. So we need to give them something which produces nitric oxide in our body. And so nitric oxide is the molecule of life. You can live for 3 to 7 minutes without oxygen, but without nitric oxide, you can't even live for 5 to 10 seconds. So no nitric oxide, no night. How do we get nitric oxide? We get it from L-arginine, which is a metabolic potent amino acid present in a normal endothelium. So this needs to be replenished. L-arginine has got multiple benefits. I will not go into the details because of the paucity of time, but it is one of the metabolically most potent amino acid which every man or a woman needs it. The ideal diet is all red colored fruits. All these have been studied, friends. All red colored fruits, vegetables, all green vegetables, cow's ghee, cow's milk, garlic, onion, ginger, sesame seed, flax seeds, saffron, oats, mushrooms, vanilla, dark chocolates, almonds, walnuts, dates, honey, white of the boiled egg, fish. Don't send your patients to the dietitians because they will, they will prescribe a diet that 8 बजे ये खाओ, 9 बजे ये खाओ, 10 बजे ये खाओ, 12 बजे ये खाओ, 2 बजे ये. Nobody can follow, nobody can adhere to any of the diet which dietitian give by time wise. So just tell your patients to avoid SOS. Now what is SOS? Salt, oil and sugar. Avoid excess of salt, avoid excess of oil, avoid excess of sugar after the age of 30. And that is very important. And Mediterranean diet has been proven to improve endothelial health, has been studied. Dark chocolates improve your mood. How do we manage? I will not go into the details about the drugs. All have been discussed very beautifully. But my point is, counseling and lifestyle modification are the mainstay of treatment of erectile dysfunctions. Don't send any patient of yours without counseling. Explain to them that what happens in diabetes, what happens in hypertension, what happens in dyslipidemia, how this can be reversed, how this can be halted, and how you can feel better. We have 4 PDE5 inhibitors and they all have side effects which have been studied. Low dose tadalafil has been very useful for a period of 12 weeks. Chronic therapy always helps. My friend Dr. Jyoti Dev has given insulin pump to diabetic patients and found 683% improvement in sexual dysfunctions. Metformin improves the endothelial health. SGLT2 inhibitors, DAPA and empagliflozin have been beautiful because of the class effects of itself by losing weight, reducing hyperglycemia, reducing dyslipidemia, etc. Buried penis syndrome can be beautifully treated with 1 gram of metformin, sesame seed oil, and L-arginine application. In 6 weeks, these patients who had never seen their penis for years together, they start having, and we can give them in PD5 inhibitors and they can have good enough sex. There are a lot of novel therapies like low intensity extra shockwave therapy, P-shot, that is platelet rich plasma, but they are very effective only in mild to moderate and we don't have robust data to prove their efficacy. New novel molecular targets which will target the endothelium have now been studied. They are either in phase 1, phase 2, phase 3 trial, but still no robust data is available. Phytonutraceuticals in the form of L-arginine, which modulate glucose and lipid metabolism, especially in obese and diabetic patients. Postprandial hypoglycemic activity has been improved with just giving fenugreek seeds and urad ki dal. Friends, these three are beautiful for your patients having low libido, erectile dysfunctions, low desire, etc. New treatment is avanafil, a beautiful drug, very short onset of action within 15 to 30 minutes, and half life is just 5 hours and has reduced PD6 and PD11 inhibitions. Visual side effects are less. And because it's a mild drug, it gets washed out from your body in 5 hours. You can give it to your patients who are on nitrates. Friends, nitrates is a little fear to all of us, to patients who we want to give PD5 inhibitors to give good sex life. But please ask them, ask their doctors. They have forgotten that nitrates are not needed for them now, so they can skip the nitrates on that day and take avanafil, which has got a very short action and it will wash off from your body in 5 hours and they can have good enough sex. It has been studied in diabetic patients, and they found that these patients who took avanafil had 2 to 3 encounters in that night. So that was very good and improved every newer molecule, include mirodenafil, lodenafil, and SLX2101. All is, but what we need to understand, are these PD5 inhibitors therapeutic, or are these curing the disease? No, it is just curing a symptom. So that's what the pharmacotherapy. If we want to cure a disease, we need to give them something called as regenerative medicine, which is in the form of L-arginine, fenugreek, or stem cell, or PRPs, etc., or some phytonutrients. So there is only 1% cure rate in patients with pharmacotherapy. 99% patients are dissatisfied with, and so there are unmedical needs. They are not effective. 40 to 50% patients do not respond. So we have stem cell.
Hello? Sir, you are not audible. Hello? We cannot hear you, sir.
Am I audible now?
Yes, sir. You are audible. Yes, sir.
Okay. So
Yeah.
my last part of my talk is, let me give you the ethical perspective. See, PD5 inhibitors, what they do is they increase the PGC1 alpha. What this PGC1 alpha does, it increases the antioxidant enzymes in the mitochondria and improves the mitochondrial function, which is nothing but reduction of reactive oxygen species, and improves the cardiac functions like the contractile function, and reduce the apoptosis. So this is what is very important, especially in diabetics. This is seen, and we know about empagliflozin and metformin, which is very important. They all improve. A direct study which showed that just with nutrition you can reverse or remission of type 2 diabetes was seen. So diabetes reversal is not a myth but a reality today. So if you are able to reverse the diabetes, or stop the diabetes, they do not have erectile dysfunction. They start getting physiological erection. In patients who are hypogonad, testosterone therapy has really helped, and these patients reduce the insulin resistance and increase their sexual functions, which was seen. Dean Ornish long time back proved that just with intensive lifestyle changes, 10% of whole 10% fat whole foods, vegetarian diet, aerobic exercise, stress management, smoking cessation, and group psychosocial support improved the coronary artery blocks even to the extent of 98%. Genes, only 20% of what happens to you is decided by the genes, 80% is dictated by your lifestyle. Is endothelial function restorable or reversible? Yes, it is, and that matters. We have statins, ACE inhibitors, antioxidants, L-arginine. Just 4 weeks treatment of L-arginine improved the endothelial functions to around 60%. So how important it is, these are the studies proof. My teacher, Dr. R.D. Lele, has long time back told us the successful strategy to reverse the endothelial functions. We have the mechanism in place. We can reverse the endothelium of our patients if we want to. So what is the future? If strategies to protect endothelium early in the life can be defined, which we can, and applied successfully, this may have an important public health benefits into the next millennium. So that is what, because most of the risk factors, which are sedentary lifestyle, dietary restrictions, smoking, alcohol, etc., all are reversible. And P. Prabhakaran beautifully showed that there is improvement in all the functions except the diet. And this is what is responsible. The healthy diet which is needed is responsible for the increase, which is not there, increase of the cardiovascular death in the body. A beautiful study done by Cleveland Clinic said that nutritional intervention, as shown in their study, will not only halt, but in also reverse the coronary artery disease. Look at this huge plaque, which was reversed without stenting. So what is the lesson we learn? The lesson we learned, which Thomas Edison told us 100 years back, that the doctor of the future will no longer treat human frame with drugs, but rather will cure and prevent disease with nutrition. So that is what we need to understand. And it is a shame for a man to grow old without seeing the beauty and the strength of which body is capable of. Socrates told us. So we need to challenge our body. We need to test our body. We need to trust our body and make a difference. It is very important. We know about early ejaculations. Depoxetin has been studied. 30 to 60 milligrams can be given once in a day. It's important. Tramadol. So the key to all, even female sexual dysfunctions, can be treated with sex therapy, pharmacological treatment, CBT, remove the risk factors, relational therapy. We have a lot of medicines also to be given to PD. But there is a gender bias. Men are given testosterone anytime when they need. Even the younger patients get testosterone by the gym instructors to increase their muscles. But when it comes to women who need HRT, there is a, I feel sexually invisible. That is what she says. A woman without sexual hormones is like a Ferrari without a fuel. So we need to give them a dose of hormone replacement. Nothing wrong in that. They will not get cancer of breast or this thing. My take-home message is teach your patients to learn what is real. Give them realistic understanding. Teach them how to expect, what to expect out of their body. Express spontaneity. Try new things in bed. It's not just about love, it's about understanding each other. Unless we love and are loved, each one of us is alone, each one of us is simply. The secret of sexual fitness is love your body. You are the best. You are, don't have a comparison between you and your neighbor, you and your friend, etc. Avoid salt, oil, and sugars. Give a U-turn to your metabolism. Have a regular rhythm of your life, sex life. Romance is very important, friend. There is no GST on romance. I find couples hardly touching each other. Trust, transparency, truth, touch is very important. Touch sets in a supreme pleasurable satiety. I find couples hardly hug each other. Being embraced is like touching hearts. Increase your romance at any age. Romance is very beautiful. It's very, very important. Sex is not for procreation or recreation. Wrinkles don't hurt, friends. Love each other unconditionally. Unless we love and are loved, each one of us is alone. Those who love deeply never ever grow old. I find couples having intercourse, ejaculate, and turn themselves on the other side. They hardly give importance to the feelings of their partner who've not been satisfied. There is no concept of afterplay. Afterplay is very, very important. What is afterplay? That once you ejaculate, you should hold your partner tight, hug her, thank her, compliment her, tell her she was beautiful, she was awesome, and do everything what you did during the foreplay again. This is very important, because if you look at a girl who's done a lot of makeover, anybody would say that she's gorgeous, she's beautiful. But if you compliment your partner in the bedroom, you are giving her a signal that you like her the way she is, and that is very important. Complimenting is very important. Communication. Feminism needs to be adored, admired, trusted, and respected. Now, why men don't respect? They have erectile dysfunction, they have issues, they don't go to the doctor, don't get treated, they deprive their partners of their sex life or the rights which they deserve. I feel that if a man who does not adore, admire, trust, respect feminism, look at Mahabharata, look at Ramayana, whatever happened. When a man who doesn't adore feminism, I pray to God that he should get permanent erectile dysfunction with no cure at all. So my appeal to all of you is be sexy all the time. So my last slide is that today endothelial dysfunction and erectile dysfunction can be reversed. It's not a myth, it's a reality today. So it's really nice to that sexual dysfunction per se or erectile dysfunction in men is a blessing in disguise, because we can reverse diabetes with lifestyle modification, L-arginine, PD-5 inhibitors, statins, antioxidants. So erectile dysfunction is a correctile dysfunction. In men, whatever be the reasons, all these can be modified. Hypogonadism can be managed. Early ejaculations can be managed with depoxetin, tramadol, etc. Lifestyle modification improves the pro-inflammatory milieu, improves insulin resistance, improves oxidative stress, and also endothelial dysfunction gives a improved well-being and reduced burden of sexual dysfunctions. So all PD-5 inhibitors we have, they do not increase the desire. 30 to 40% of these patients are not responders. So we have testosterone, but we need to give it with caution. We can't give it to younger patients because of the fear of azoospermia, heart failure, or prostate issues. We can't give it in younger patients because of azoospermia fear, and elder patients can develop prostate issues. So what we have the Raja of all, which we can give in the form of L-arginine, fenugreek, which is very safe, compliant to the body, lifestyle modification, don't need any cost, and of course, regenerative medicines. So friends, love really has no expiry date, and we are all born out of love and sex. So love each other unconditionally. You are partners for life. Friends, please trust me, wrinkles don't hurt. It's even touching, it's even holding each other, sleeping together, and making your lifestyle and making yourself sexually fit is all in your hands. Sexual dysfunction is not an option for anyone. It is how gracefully we handle the process and how lucky we are as the process handles us. So if you have patients of erectile dysfunction, please don't send them to any quack. वो सिर्फ पुंगी बजाएगा. Send them to a good sexologist and you will see that he gets a good erection. This is my book, Sex Has No Expiry Date, which is available on Amazon. My last slide. Friends, sexual dysfunction or sexual fitness is a lifestyle decision which we all need to take and all need to counsel our patients to take. Age, weight, height are just numbers. A heart that loves is always young. To be sexually fit is your choice. Low dose PD5 inhibitors, statins, L-arginine, fenugreek, lifestyle modifications are game changers. All sexual dysfunctions can be managed. The best aphrodisiac today is not any medicine, but your fantasy and your excited partner. And if you do so, sex really has no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have.